It felt like somebody was putting a knife in your knee, and to the point where you couldn't walk, just couldn't walk. So I made an appointment to see Dr. Larson to find out what was wrong, and that's where I found out I had arthritis in my left knee. I had a total knee replacement. Dr. Larson did a great job. The surgery was good, but after surgery, I couldn't straighten my leg. When I was doing my home therapy, I felt like I had a web of string, and every time I would bend my knee, it just felt like it was pressing. So when I started outpatient physical therapy, and I told them I was having this issue, they offered the Astym, and then they started working on me with that.
Astym is a form of regenerative medicine that we use to help stimulate growth factors, and it helps to break down scar tissue and stimulate regeneration of tissue, so it actually goes back to the pre-injured state to help heal dysfunctional tissue. What we do is we have different size of instruments that we use for the different areas that we're treating, and we run the instrument along their skin, usually along the fiber of the muscles or the tendons and the ligaments, and what it does is it helps to stimulate that regeneration of the tissue actually at a cellular level.
I started feeling a release, a difference, then the web of string went away, and then they started working on my whole leg, and I just felt the difference, like my leg was straightening out versus walking with a bend. I felt much better. I was relieved.
It can actually be immediate results, so usually the patient will come off the table, sometimes even feeling a little bit better that day, more flexibility, more motion.
I can now stand up straighter, which though everybody told me I lost a ½ inch in height, which now I've gained my ½ inch back. I avoided steps, go to places where I didn't have to walk steps. I can actually walk steps normally. They taught me how to walk steps again. I really couldn't do anything before because I couldn't walk, so I put on a lot of weight. Now my weight loss continues because now I can walk. I can actually walk. I can actually get around, so I can maintain my weight loss, and also I got myself a Fitbit so I can keep up with my steps, 10,000 steps a day.
It's very exciting. I mean, I love seeing people happy when they leave, especially the immediate results. I love that. I mean, usually we tell patients it might take a few weeks to feel better, but I like that the Astym, they might feel better right away that day. We actually are the only clinic in the area within the 50-mile radius that does Astym. I love using it. I really feel like it's added some tools in my toolbox as a therapist. For treatment, I feel like I can treat a lot of different diagnoses with it. It's been very helpful.
Went on to move to schedule my right total knee, and Dr. Larson did both procedures, and then that's where I am today, back at physical therapy to work on my right knee. I've been feeling great. That's the best thing. The physical therapy and the Astym. I mean, I never knew such a simple thing could work. I'm glad I did it. I would do it again for anything else.